Hi, today I thought I would talk about breastfeeding and how osteopathy can make a huge impact on how successfully you're able to breastfeed your child and how successful that may be for you too as the breastfeeding mum. So my name is Gayle Palmer. I have been a registered osteopath for nearly 30 years and I've specialised in obstetrics and gynecology and paediatrics for over 30 years now. So that's a little bit more about me. I work from the Living Elements Clinic near Chichester. So I brought my model along today. This is Ted. And Ted's hopefully going to help me explain why osteopathy might be the solution to some of your struggles, particularly with newborns. And I hope that this will help. So what are the problems that we get with breastfeeding? Well, let's look first of all at what may cause some of those problems. One of the biggest issues that we have is birth is not a simple thing for mums and babies to go through. Months and months of pregnancy may be one thing, but actually the birthing process can be quite difficult and that can lead to problems. So if I introduce my little spine here, it's only a little critter, the areas that get most compressed and struggle, stay there Ted, is the upper neck region. And it's from here that there are lots of nerves that come out around the base of the skull itself, so sitting on the neck like that, but also from around the upper neck. And they supply 2/3 of the gut, so stomach, small intestine, large intestine, liver, lungs, heart, thymus, thyroid, the sucking and swallowing reflexes. So if these nerves get compressed or restricted, and that happens frequently during birth because it's a traumatic event, whether you have a natural delivery, a ventouse delivery, or even a cesarean section, or just a natural delivery that goes on, or if you have a really fast delivery and the baby gets expelled like it's shot out of a gun. All of those things can have a shocking effect or a torsion effect on the skull itself, which is still very much in its infantile stage. It's made up of small areas of bone which are surrounded by an interesting type of cartilage, and it's very flexible and pliable. So if you have a lot of birth trauma and stresses at this time, it can really struggle with its normal function. Now, our babies are designed to survive delivery. Obviously, we wouldn't be here otherwise. But those traumas and stresses and strains may not get resolved as the baby feeds and grows and develops, and they're important to get resolved because then we have normal, natural, healthy development and your baby can thrive, which is what we want, isn't it? So with the birth trauma, that's an area obviously that as a cranial osteopath I am well able to address and treat. But there are other areas that can get stuck too, which can lead to feeding problems generally. And one of those other areas particularly is around the diaphragm, so between the torso and the abdomen. This is a large dome-shaped muscle, and when you get stressed or you've had a shock, and being born can be quite a surprise in itself, this can get restricted in its function. So instead of being able to have a big excursion as you breathe out, the diaphragm remains tight and it forms tension and flattens the dome of the diaphragm, and that compresses the gut, but it also, more importantly, restricts the nerve supplies which go through the diaphragm and supply the gut, particularly the stomach, and it can make it very irritated. So babies get hiccups a lot, they get very uncomfortable, they can get reflux, they possit more. It's not a great scenario. For mums, breastfeeding is a whole different world. So we're not used to breastfeeding in our ordinary life, are we? Let's face it, it has a unique function. And posture when you're breastfeeding is a really important area to look at and deal with. I often see, and this is why I've got Ted, whoops, spine's just disappeared. I often see mums breastfeeding like this and then looking down watching the baby like it can't remember how to feed. Trust me, it will feed. Now I know that getting the baby placed onto the nipple, getting them to open their mouth wide enough, get a good mouth seal, does involve looking at the baby. But once they're finally feeding, then you need to improve your posture. Now I'm sitting in a very old chair. It's 50 odd years old, and it's very low. You can see that I've got my knees bent. So although I could have a pillow here, particularly if the baby gets that much bigger, Ted is rather a large baby, but obviously rather light. In fact, it's got quite low arms, and you can just rest your arm on there and the baby's held and supported, and you don't need to be holding them and moving them around. So you have to, there are a whole load of techniques which I can teach you as an osteopath to help get that baby to latch on well, and also to really look after your posture. But it's really important as a breastfeeding mum to get you comfortable to start with, and then after that get the baby positioned and feeding properly, okay? Because you're going to be there. For some babies, they'll drain a breast in 10 minutes. For others, if you're having struggles, 40 minutes, an hour feeding, and it's not very successful, that can be quite normal. It's not normal. If your baby feeds for that length of time, please come in, make an appointment immediately. Let's get that sorted. That is not normal. It is exhausting both for mum and baby, okay? So posture really important. You might find, depending on the type of chair or seat that you're using, you need to put a cushion behind your back. You may need to have your arms cushioned. Sometimes those V cushions are really useful for that because they help to shore you up. Now for mums, excuse me Ted, for mums, the area that gets particularly stressed is the upper neck, because you're looking down, and your upper back. And your upper back is the area that has the nerve supplies that come out and supply the mammary glands themselves. So if that area here gets particularly stressed, particularly if you're curled up like this, you do that sideways, you curled up like this, watching the baby feeding, that area is already under a lot of stress and strain, and you won't be producing probably gold top milk. We want thick, fatty, nutritious milk. Okay, so one of my responsibilities as the osteopath is to make sure that you are producing gold top milk, not thin, watery, red top milk. Does that make sense? That's what babies need to thrive. Okay, so in my osteopathic practice, I'm working not only with the mums and really looking at your nutrition and your posture and how everything's recovering from the birth trauma itself, but also we're looking at how the babies are able to function and feed, because it's a synergy between you as the breastfeeding mum and the nipper. Okay, you both have to work together with each other, and it's all done by our unconscious nerve supplies largely. So when they have a growth spurt, there's a time delay, but then your breast will produce more milk. Now, if that doesn't happen, or it doesn't happen adequately, then we have irritated babies. It's not great. So as an osteopath, I'm able to advise and help on all of those areas and get you able to thrive and your baby able to thrive, which saves loads of heartache, loads of tears, loads of upset, particularly in the first 3 months that they are born. Other things that I will be looking out for, tongue tie, very common. There's an area of our tongues, we don't see our tongues very often, and hopefully I'm going to be able to show you this. There's a frenulum. that little slip of tissue which helps to control our tongue. But when there's tongue tie, the frenulum is a bit too long, and sometimes it doesn't even look like it's too long, but it stops the baby's tongue from functioning properly as it sucks. That's a really simple thing to resolve with a nip from the local doctor or nurse. It's very quick, it heals brilliantly, but it makes a fundamental difference. As an osteopath, I'm trained to check for tongue tie. And other things that might be a giveaway that things are not working quite well. Yes, obviously there's the milk quality, but also if the baby's suckling and it's very noisy, or there's a lot of posseting, so being sick, or reflux after a meal, and it might well happen an hour or even 2 hours after a meal, even projectile vomiting. So all of those things are signs that you should come in to see me as an experienced cranial osteopath. Let's get things working. So if you want to get a hold of me, you'll be able to find the book online button, and you can do it directly, or you can give me a call at the Living Elements Clinic in Siddlesham, Chichester, and we'll get you and your baby working to the best of our ability. Then you can enjoy your newborn days as opposed to struggle, get upset, get incredibly tired and be miserable. We don't want that, do we? So that's Gayle Palmer from the Living Elements Clinic. Your health is my priority, and so is your baby's. Just because someone loves me.